Namaste, welcome to iDream Health Time. The liver is an important organ that sits just under our rib cage on the right side of abdomen. The liver is essential for digesting food, ridding your body of toxic substances. Liver diseases can be inherited. Liver problems can also be caused by a variety of factors that damage the liver, such as viruses, alcohol use, and obesity. Over time, conditions that damage the liver can lead to scarring, which can lead to liver failure, a life-threatening condition, but early treatment may give the liver time to heal. So, in this regard, right now we are with Dr. Thomas Charlin, and we will get more information about treatment of liver related health issues. Namaste, sir.
Hi.
Sir, where are you from actually?
I'm from Kerala, but now I think I'm a Hyderabadi. I've been here for the last 10 years.
Oh, from the last 10 years you will be there only.
Yes.
Yeah, okay. Sir, what are the first signs of bad liver?
So, the first thing to say is that when a liver gets spoiled, initially there are no signs or symptoms. Until about 50% or 55% of the liver gets spoiled, there is no symptoms, and that's the first thing that I want to say. Because many people think, okay, I'll wait until symptoms start, then I'll go to see the doctor. So, but once about 40 to 60% of the liver is spoiled, then the typical symptom is bilirubin, that is high, which is the yellow discoloration, what people call jaundice, then water in the abdomen, blood vomiting, and then some very advanced cases can even go to what we call hepatic encephalopathy, which is liver coma.
Okay. What is the main cause of liver problems, sir?
Good question. So, when I worked for nearly 20 years in London, so the commonest cause at that time, 10 years ago, was alcohol and viral hepatitis.
Oh.
But now I run a hospital called South Asian Liver Institute, and in South Asian Liver Institute we have been doing transplants for the last 10 years. We have done about 320 transplants in Hyderabad, and now the number one cause of liver disease is fatty liver disease.
Oh.
And alcohol liver disease is only about 30% or 25% of my patients are due to alcohol liver disease. Many people think liver disease is equal to alcohol liver disease, but it is not. Even children, I have transplanted children who are only 7 months old, 6 months old. How can they have liver disease due to alcohol? So 70% non-alcoholic, 30% alcohol.
Okay.
About 40% is due to fatty liver disease now, maybe 35%, and the remaining 20% may be hepatitis B and C, and then 10% all the other causes put together, such as genetic causes, Wilson's disease, tyrosinemia, and other such things. So the number one in India at the moment is fatty liver disease, and I think unfortunately the way we are eating and the way we are not exercising, this number is going to increase.
Oh. Okay, sir. You said that not only above the 50 age, or kids also affect with the liver diseases. At what age that liver problems will come to earlier?
So, like I said, the liver disease can affect babies just born, and it can affect people all the way until 80 or 90 years of age. However, the children usually, if they're going to get affected, they'll get affected in the first 1 year or 2 years. So there is a peak among the children at that age. Then the next peak is at around 40 to 50 years of age. and then the next peak would be at around 60 to 65.
Is this age only, or 30, 35 also will be affected?
Liver disease can come at any age, but I'm just saying these are the common ages. So that's where there is a peak, and then it comes back to what we call average rate of incidence.
Is genetic liver diseases also causes?
Yes. So, for example, the child with liver disease, the commonest disease is called biliary atresia. It doesn't have a genetic link to it, but it is a birth defect. So genetic things like tyrosinemia, Wilson's disease are also able to cause liver disease. So Wilson's disease is a very special thing. I had recent 2 children with Wilson's disease, and one was 7 years old and one was 5 years old. And the 7-year-old was found to have chronic liver disease and cirrhosis. And then they did a transplant. But when we did the transplant, we found that her sister has got Wilson's as well. And so we started medical treatment in that child. And because of that, that child's liver did not get spoiled, and she has now been saved from her transplant.
Okay. Is chronic alcohol consumption habit leads to liver problem?
Yes. So what we call alcohol abuse, that means excessive amounts of alcohol on a daily basis, definitely will cause liver disease. Say 50 years ago, that was the #1 cause of liver disease in the world. But now, like I said, it is not the #1, but even today, about 30% of patients are due to alcoholic liver disease. And what is particularly worrying to me is that alcoholic liver disease is increasing not only in our country, but in almost every country in the world. And unfortunately, the younger generation, our children, are now drinking alcohol at a younger age than we ever did. So the average age at which people are starting to drink used to be around 19 and 20. Now the average age is about 16, which is really worrying, because if the average is 16, that means even 13 and 14-year-olds are beginning to drink, which is why the average is 16.
Yeah, some doctors said alcohol is not the. And if we take alcohol, it's a help to health. For health purpose, you take some alcohol, it is not a problem. But in that case, a 16 to 17 people also, they take 16 years and 17 years of people are also they will take. In that, what is the main cause? Alcohol, how it affects on the liver?
So, why some doctors, as more as a joke than anything else, would say that a little bit of alcohol is okay, is that alcohol has got anti-platelet effects, and therefore when there are people who take, for example, aspirin, so this has got a similar, not the same, but similar effect, and therefore instead of having aspirin, you could say that maybe 1 glass of wine 2 or 3 times a week might have some benefit. But I am talking liver damage happens because of excessive drinking. So drinking much more than that on a daily basis for many years. And the wonderful thing about alcoholic liver disease is that warning signs are there. Therefore, my suggestion is anybody who is thinking that I may be drinking a little bit more alcohol than I should, then it is better to get your liver checked early, so that if we find that there is already damage, then we can advise you to cut it down or even stop, and then hopefully they will not reach cirrhosis or require transplantation.
Yes, sir. Such a prescription is over-the-counter medication causes liver issues. And we take more medicines and some prescriptions. We take several years.
Yes.
It is caused by liver.
So, in general, paracetamol, for example, is something that's taken over the counter. Paracetamol at high doses can cause liver failure, but at very high doses. So usually, for example, if somebody is trying to harm themselves by taking tablets, paracetamol causes direct liver injury. Now, in South Asian Liver Institute, we have seen maybe 8 to 10 patients who have had liver failure due to non-allopathic medications. So country medicines, where they were taking it usually for jaundice. So there are people who had, for example, hepatitis A. And with no treatment, hepatitis A will get better in about 2 weeks' time. Slowly, with just drinking enough water, getting some rest, in 2 weeks' time, usually hepatitis A will go away and the liver goes back to normal.
Okay.
But sometimes when they get jaundice, people get worried and they go and take what I would call spurious medications from illegal medical practitioners, and then they come with serious liver injury that needs a transplant. Over the last 10 years in Hyderabad, I must have seen that at least 8 to 10 times, and that is something that we should try and avoid.
Is there any vaccine for that?
Well, the only vaccine available for liver-related things is a vaccine against hepatitis B. So, children born after 2007 or maybe 8 have been vaccinated by the government of India at birth. So, they are protected. But people born before 2008, let's say, have not had the vaccine automatically. And therefore, they should check themselves for hepatitis B, which is a simple test, a simple blood test. And then if it is negative, they should take the vaccine because it then protects them from hepatitis B for life. At South Asian Liver Institute, we give vaccinations almost to everybody who comes who has not had vaccinations before, because it's such an inexpensive vaccine and it protects them against such a serious complication that I don't see any reason why all of us should not be vaccinated.
So, you said about that hepatitis B.
Yes.
If there is some other hepatitis A, hepatitis C, hepatitis D, hepatitis E also is there, what should we do if it's affected?
So these are all very, even though they're all hepatitis viruses, they're all behave differently. So for example, hepatitis A, what I told you, this just comes from infected food and water. So eating a jalebi outside that has been not kept properly or not cooked properly, you can get hepatitis A. Usually it gets better on its own. Simply just waiting, like I said, some supportive medications, maybe some vitamins, 2 weeks later you'll be back to normal.
Okay.
Whereas B and C, you don't get it from food, but it is through blood contamination. Okay. So blood transfusions, people who have regular hemodialysis, people who IV drug abuses, these are the people who get hepatitis B and C, and these are more serious illnesses that need treatment and importantly surveillance. And therefore in South Asian Liver Institute we have something called LICAP, so liver care program precisely for people like this. So for example, if you got hepatitis B, you want to know, is my liver getting spoiled? Is my liver needing a transplant? So what we try to do is we assess these patients, then we put them on a regime that keeps the hepatitis B under control, and we also monitor the liver for complications in the future, and that almost in 90% of cases we are able to keep their livers healthy. Occasionally, when they have come to us too late, when the liver has already become cirrhotic, then it is difficult for us to help with medicines. These are the people whom we advise transplantation for. But the good news is transplantation has got more than a 90% success rate, and they can go back to a normal life afterwards. I've even got auto rickshaw drivers who had a transplant with us. I have had fruit sellers, not the Bundy fruit sellers, but a shop owners who have selling fruits. They have gone back to selling fruits in their shop.
If you have positive of hepatitis B,
Yes.
what should we do to prevent that?
So, once you have had hepatitis B, obviously you cannot prevent it. So, the key thing to prevent hepatitis B is the vaccination.
Okay.
So, the unfortunate truth is that hepatitis C doesn't have a vaccine, and therefore, hepatitis C is something that I think everybody over the age of 40, it is such a simple blood test, should take that blood test, and if it is positive, there is very good medications for it now, and it can be cured. But without detection, so if you don't do the blood test, you never know that you have hepatitis C. In fact, we in our country have got about 20 to 25 million people with hepatitis C. But what is interesting is, out of this 20 million, nearly 10 million don't know that they have hepatitis C. Therefore, if you can afford it, I think the test is not more than 400 or 500 rupees. You must get hepatitis B checked, and if it is positive, come and see one of us liver doctors, and we will be able to guide you as to what needs to be done.
Okay. Which is the most dangerous, hepatitis B or hepatitis C?
Difficult to be sure. About 10 years ago, if you had asked me this question, I would have said hepatitis C, because it didn't have cure. Now we have direct acting antivirals that provide fantastic cure for hepatitis C. Therefore, in a funny way, I think maybe hepatitis B is more dangerous.
How to identify the liver problems at home?
Like I told you, the symptoms that I told you about earlier, the jaundice, these are the things that you can use to know that you may have a liver problem. But I think
Jaundice is the not more than the liver problem, na sir. Everyone get the jaundice and cure it, but hepatitis B or hepatitis C, we can't imagine how is it we have that.
jaundice is just a sign of liver injury. So that liver injury may be viruses, it may be a genetic disease, it may be alcohol. So jaundice just means that you have a liver injury. And one very important thing is, if you get jaundice and it disappears in 1 or 2 weeks, then it's okay. But any jaundice that doesn't disappear for more than 2 weeks or 3 weeks is definitely something that is dangerous and must be looked after.
Okay. Is there any home remedies to take at home for the hepatitis B or liver problems?
Yeah, well, like I said, hepatitis A, it only needs some lemon juice and water and rest. But other illnesses need tablets, need injections, and a lot of investigations to see how much of the liver has got spoiled already. So I think in general, liver diseases is not something that you can sort of manage at home, but there is an exception. So let us look at fatty liver disease. So now, in South Asian Liver Institute, approximately 10 to 15 patients of the outpatients is just for fatty liver disease. So grade 1 fatty liver disease, grade 2 fatty liver disease simply requires weight loss, a good diet, exercise, and not getting fat. If you are a diabetic, then controlling your sugars. All of this are things that anybody can do at home. So for fatty liver disease in the early stages, the treatment is simple. It is just the awareness that is the problem. People don't know that they could have fatty liver disease. Many people think, I don't have any symptoms, therefore my liver must be normal. But that's wrong.
How to prevent this, sir?
So I told you, it's just controlling your weight, controlling your sugars, and making sure that you're not eating the wrong food and not eating the wrong quantity of food. So we eat a lot of what do you call that? Laddus and sweets. And so about 2 years ago, South Asian Liver Institute put an advertisement in the newspaper saying we put a plate of jalebis, and we said, you see jalebis, we see fatty liver disease.
Oh, most of the sweet, we take more sweets, we get fatty liver.
Yeah, sugar is the problem.
Okay.
But see, I don't think that it is the sweet. It is the amount that you eat. For example, if you are well behaved, you have a normal lunch, a small quantity of lunch, and it is Diwali and you are having one jalebi, that's not a problem. I am talking about people who are having no control on their eating habits, sweets all the time, a lot of rice. These are the people who get into trouble.
Okay.
Not otherwise.
Is there any side effects will occur if we use long-term medicines for liver or health?
All medications can have side effects. And the important or the common side effects the doctors will always warn you about. Therefore, as long as you listen to your doctor, one of the things that I've noticed here is that there are many people who, as soon as they get a temperature, they will just go to the pharmacist, and the pharmacist will say, oh, I'll give you this antibiotic. I find that very dangerous. In fact, one of our campaigns at South Asian Liver Institute is against unrecognized administration of antibiotics. This creates a lot of problems for us because many patients are now coming to our hospitals with antibiotic resistance, which is a huge problem now and in the future going to be even a bigger problem. So for example, I told you I worked in King's College Hospital for nearly 6 years and in other parts of UK for more than 15 years. Nowhere in the UK will a pharmacist be allowed to prescribe antibiotics. Without a doctor's prescription, nobody can give out an antibiotic. And doctors also will not give out antibiotics unless they are fairly convinced that there is a bacterial infection going on. So such sort of regulation must happen. In King's College Hospital, I would have done more than 400 liver transplants. And the kind of antibiotic resistance that we are seeing now in India, I have never seen before in the UK.
Yeah, if we have a family history in the liver diseases, is it upcoming generations get it, sir?
So I think even fatty liver disease has got a genetic component to it. So I'm sure we all know there are people among us who eat a lot but still remain thin. And there are other people who I call the unlucky few who eat not so much but they get fat. So I think there is a genetic component to getting obese itself, and therefore there must be a genetic correlation to that. And what I told you before, Wilson's disease has got a definite gene associated with it, which can be identified with gene analysis. But things like hepatitis, things like alcohol is not genetic.
What should we do first? We don't affect with the liver.
So I think the rules are very simple. Even if you consume alcohol, don't overdo it. Stick to a smaller amount. And I think this is the time to say that you ladies have a disadvantage. So a man has got a bigger sized liver compared to a woman, and therefore our ability to tolerate alcohol is slightly higher than a woman's. And therefore, especially we are seeing more and more now, which is a new phenomenon, more and more young women are drinking, and they are not able to drink as much as their own classmates who are boys. And therefore, when it comes to your question, which is what do we do? I think even if you're drinking alcohol, in moderate quantities. Don't abuse alcohol, number one. Number two, stay thin, definitely not fat. And if you are bulky, it should be bulk because of muscle rather than fat. Eat healthy. So what I mean by that is, many of us eat even when we are not hungry. Why should we do that? No animal does that except us. So if you're hungry, eat what you need. Stick to high fiber content food like wheat. Rice is particularly bad. If you're having rice, you should decide before you start, how much rice am I going to eat? And it should not be more than 1 cup. Lots of vegetables. Vegetables are very rich in antioxidants, very rich in vitamins. All of these things are very important for liver regeneration. Okay. So in South Asian Liver Institute, I told you about LICAP. 2 important components of LICAP is the dietitian's role and the physiotherapist's role. So the physiotherapist teaches them cardiovascular exercises, and the dietitian teaches our patients what to eat, and more importantly, what not to eat, what quantity. And then what we do is every year we assess those patients, and if those patients are deteriorating in any way, we take extra precautions to bring them back into liver health.
Thank you very much, sir.
Thank you.
చూసారు కదా, ఫ్లాటీ లివర్ అండ్ హెపటైటిస్ బి, హెపటైటిస్ సి రావటం వల్ల ఎలాంటి ఇవి జరుగుతాయో. అండ్ నెక్స్ట్ మరొక అంశంతో మేము ముందుకు వస్తాం. స్టే విత్ us.